Hello guys, Peter Kilo here at Words of Healthy podcast. Welcome to my episode 1 of my podcast series, and our topic of discussion today is the blood pressure and the salt. So blood pressure can be categorized into two. We have what's known as the high blood pressure or hypertension, which is the consistent elevation of blood pressure above normal. Then we also have hypotension or low blood pressure, which is consistent reduction of blood pressure below normal. So I guess you people out there have once gone to the hospital with a condition of hypertension and you have been told to reduce salt intake, or you have gone to the hospital with a condition of low blood pressure and you have been told to increase salt intake. So today I want to clear out the relationship between blood pressure and the salt. So salt is one of the factors that tend to increase blood volume because it tends to retain fluid in the body. If you are eating a lot of salt, this is going to make your blood volume to expand or increase, and the increase in blood volume is going to make the heart to start generating more force to pump that blood, and that makes blood pressure to increase, and you end up finding yourself in a hypertension state. When you go to the hospital, you'll be told to reduce salt intake, because we understand that salt intake does increase blood pressure. So if somebody has gone to the hospital or come to the hospital with a condition of hypertension, when they reduce salt intake, the blood volume is going to reduce, and that's going to make the heart to start generating minimal pressure to pump that blood, and the blood pressure also is going to reduce near normal or at normal level. Same applies when we go to somebody with the hypotension. Hypotension, we're talking about blood pressure below normal. So a patient is going to be advised to increase salt intake. Why? Because we are still using the same concept of understanding that salt tends to increase blood volume, and that makes blood pressure to rise. So in a case where somebody has hypotension or low blood pressure, when they increase salt intake, that salt is going to boost blood volume, and when blood volume increases, the heart is going to start generating more force to pump that blood, and that makes the blood pressure to start rising, coming from low to normal. But take note that either you being with hypotension, then you start taking a lot of salt, you can end up even bypassing the normal level and find yourself into hypertension. Same applies in somebody with hypertension. As you reduce your salt intake, you can bypass the normal levels of blood pressure and find yourself into low blood pressure. So the advice is in as much as you are following doctor's order or nurse's order to either reduce salt intake or increase, make sure that you normally check your blood pressure regularly, going to the hospital either once in a week, so that you are able to monitor your blood pressure near normal levels. If possible, you can also buy a BP machine and go to the hospital. They will teach you on how to use it so that you can be monitoring your blood pressure home. I guess you have learned something from this episode. My request from you people is to help me share my content to your family and friends, and also continue requesting some topics that you want me to generate or create videos on. With that said, I'm going to talk to you in the next episode. Bye.